Imagine if there was a way to treat erectile dysfunction without pills, without a prescription, and with something you can apply in just 15 seconds. And get this, it starts working in under 10 minutes. Sounds like something out of a sci-fi movie, right? But it's real, it's called Eroxon Gel. Hey everyone, welcome back. Today, we're diving deep into Eroxon, the very first over-the-counter OTC topical gel cleared by the FDA to help men with ED. Whether you've heard about it from ads, friends, or just scrolling on TikTok, by the end of this video, you'll know exactly how it works, whether it's legit, and if it could be an option for you. What is Eroxon? Okay, let's break it down. Eroxon isn't a pill, it's a topical gel applied directly to the head of the penis. Each dose comes in a single-use tube. According to official info, you massage the gel onto the glands, that's the head, for about 15 seconds. It's meant for men 18 years and older with mild to moderate erectile dysfunction. Eroxon, and the best part, it's available without a prescription in many places. How does it work? So how does a gel make this kind of magic happen? Here's the science. The gel has a unique evaporative formula. When you apply it, the volatile components evaporate very quickly, creating a cooling sensation. Then, as it warms back up, it stimulates the nerve endings on the penis. This stimulation triggers the release of nitric oxide, which then opens blood vessels, more blood flows in, and that helps you get an erection. In clinical trials, more than 60% of men achieved an erection within 10 minutes of applying the gel. Because it works locally on the skin and doesn't go deep into your bloodstream, it minimizes systemic side effects. That's a big deal. How to use it? Here's exactly how you use Eroxon. Open a tube, unscrew the cap, pierce the seal, and squeeze the entire content onto your fingertip. Apply, rub or massage the gel onto the head of your penis for 15 seconds. Wait, give it about 10 minutes to start working. Turn on the romance. Sexual stimulation is needed. The gel alone won't do the trick. You need arousal. One-time use. Each tube is for a single use only. Be patient. If it doesn't work on your first try, don't worry. The official guide suggests it may take a few attempts to get used to how it works for you. Safety and side effects. Now, let's talk risks, because every treatment has trade-offs. Eroxon is generally well tolerated. All XO and DOTUS. +1. Some possible side effects. Skin irritation. A few men or their partners reported mild burning or tingling. Headache. Around 3% of men in studies. Allergic reactions. If you're allergic to any of its ingredients, don't use it. Not for everyone. If your penis skin is damaged, irritated, or you have certain medical conditions, it may not be safe. Also, very important, while it's safe with latex and polyisoprene condoms, it's not compatible with polyurethane condoms, according to the manufacturer. Because Eroxon acts locally and doesn't go systemic, it's less likely to interact badly with other medications. But if you have serious heart conditions, you should definitely talk to your doctor. Sex itself can put stress on your heart. No prescription needed. Fast-acting approximately equals 10 minutes. Minimizes systemic side effects. Safe to use with many condoms. Who it's best for? Eroxon might be especially useful for men who can't or don't want to take oral ED pills like Viagra or Cialis for medical or personal reasons. Boots. Guys who value spontaneity. You don't have to take a pill 30 to 60 minutes before. You can apply it as part of foreplay. Partners who want to be more involved. The gel can be massaged on by you or your partner. People looking for a treatment with minimal systemic risk since it's local, not systemic. Warnings: when not to use. You're allergic to any of its ingredients. The skin on your penis is damaged or irritated. You've been advised by a doctor to avoid sex, for example, due to a heart condition. If you're under 22 years old, the safety hasn't been fully established for younger men. Also, use only one tube per attempt. Overusing won't help more. It's designed as a single-use dose. And if after trying it a few times it doesn't work, talk to a healthcare provider. There may be other or better options. Why it's getting attention? Viral potential. This stuff is making waves because it's the first known pill FDA-cleared ED treatment you can just buy over the counter. No need for a prescription, no blood pressure concerns directly, and you don't have to plan way in advance. For a lot of men feeling anxious or embarrassed about ED, that's huge. Plus, the sensation is different. It's not a chemical drug, but a cooling then warming effect that triggers your body's natural response. That's novel. And in a world where intimacy matters, not just function, Eroxon positions itself as more than a med. It's part of the moment. If you or someone you know has been struggling with erectile dysfunction, especially if you're wary of pills or their side effects, Eroxon could be worth exploring. But, and this is important, always talk to your doctor or a sexual health professional before trying something new. Hit the like button if you learned something new today. Subscribe if you're into deep dives like this, and drop a comment below. Have you tried Eroxon, or would you consider it? Let's get the conversation going. Thanks for watching, and here's to more confidence, more connection, and more spontaneity.